Hi, it's Dr. Janowski for Sonata. Today we're going to use some fillers in the midface. Midface is extremely important, probably the most important area for fillers, because when we're young, the midface is really the most volumized area, and then we taper down to the lower face. And of course, as we age, that starts to get reversed, right? So that there's more volume down here and less up here. So we always want to try to maintain that nice triangle of youth, with the midface being the most volumized area. And so we lose volume in the cheeks and the nasolabial fold, so that's what we're going to do today. And so really what we need to do is nothing drastic, but we want to create a little bit more curvature in the anterior part of the cheek and have it come around to the side, and then also soften that fold there. So all of that is really easy to do. I'm going to do most of this with a cannula, a little bit with needle here, and we put some numbing cream on her, and it should be very quick and easy, and I'll show you how I do it. So there's a number of ways you can inject. I like using a cannula. It's safer. Patient doesn't feel very much, less bruising, and we have a lot of control about where the product goes, and we want to keep it deep. So I've created 2 entry points here with local anesthetic, so the patient won't feel anything going in to the skin, and then we're simply going to pinch the cheek here and then advance our cannula right over that zygomatic bone. Here we go. And then we're just going to slowly inject. Apex of the cheek should be right about here, so we're going to accentuate that nice cheekbone and just inject a little bit. I'm using Restylane Lift here, and we're just going to create a nice little curvature to the cheek here using our micro cannula. So that's one. And so we see here we have just a nice curvature to the cheek. And then we're going to come around this side, and I'm going to do the same thing. And we're right over the bony part of the cheek here. Again, I'm going to pinch, and then that keeps the cannula deep, kind of right over bone. And then we're going to inject as we come out, watching the formation of the volume. And we're going to fan around this part of it. Okay, there we go. So that's that lateral cheek. That's looking good already. And then we'll lift her up, and we'll do a little bit in the anterior where it's getting a little bit flat here. And again, I'm going to let's use Restylane Define. Yeah, so I like Define here because there's a little bit more motion and muscular movement, and Define is a flexible product. So there's our entry point. We're going deep here, and then we're going to slowly inject and create that curvature there. Good. And we're moving the cannula, making sure everything is safe. Good. You can even come towards the nasolabial area here. Okay, good. We're getting that in. Creating a nice curve that goes all the way around to the front. So these are my preferred entry points here. As we come up into the area, and we're below the infraorbital nerve, so it should be pretty easy. Again, we're moving our cannula back as we inject, coming up a little bit higher here, creating that curve as we go around. Little poke, sorry, good. And then we'll come across into just a drop right here. Good, okay, that part's in. Now, take our little buzzer, and I like to use a needle technique here because we want to be pretty close to the dermis here, intradermal, deep dermal. And I always like to use this little vibration tool. It makes it easier for the patient, and we use numbing cream as well. So we're going to use this serial puncture technique, keeping the product pretty superficial We don't want to go deep where the artery is. Good. Let's rest your facial muscles. Good. And then we'll also go across the fold. Sometimes when the fold's deeper, we can go across it, and that effaces it a little bit easier, a little bit better. Good. We're softening that whole area up here. Staying superficial. Okay, good. Almost done. So we'll do the same thing on the other side here. And we'll be done. So, again, the fold's fairly deep, so I'm going to come across it a little bit like this. And I like to torque the needle a little bit like that as I come across. Helps to lift the fold up a little bit. Good. Almost there. I'm going to use my little buzzer as a helper. Almost there, just have a few left. Softening that up there. Coming across the fold. Okay, good. That's it. So, just took a few minutes there. Massage the area. Alright, so we can see more mid-face volume there, creating more of that V shape. Very natural look. Doesn't look overdone. And I used 3 syringes. And then we'll just put some arnica on, and that's it. So the patient can ice if they want. I don't expect bruising here. These are not typical bruising areas. And then everything will settle nicely into place with very little recovery. Okay. So that's a mid-face injection with a combination of cannula and needle technique.